All right, let's wrap it up here. We just finished talking about the 7 major thyroid patterns, and you see those up there on the screen right now. What I find in my office, though, is we have a situation where chronic cases, such as thyroid issues, there are about 40% metabolic, meaning there's things that aren't working right in the body, and they're about 60% neurologic. Now, if you think about this, this does make sense, because what is the structure in the body that runs everything else? What structure has the job of being in control, monitoring, coordinating, and regulating the function of everything else? And that's your brain. So if the brain is not working right, then that's going to impact your hormones, that's going to impact your digestion, it's going to impact your sleep, it's going to impact your energy, it's going to impact everything. So we have to have a healthy awareness of what are we doing to evaluate the brain and what are we doing to give the brain what it needs so that it can function appropriately. And even though this question is a no-brainer, I mean, we've got grade schoolers going to say, well, the brain runs the body. How much of our actual evaluation in our traditional healthcare system focuses upon, is your brain working well? Very little of it does, short of, hey, let's send you to the brain doctor, the neurologist. But the brain runs the show. And so in any type of a situation, particularly with a chronic illness, we should always have some attention put back on brain and how well it is functioning and what is it doing. So common to all chronic health problems, these are things I see. So conditions such as thyroid problems, dizziness, chronic fatigue, neuropathies, headaches, fibromyalgia, irritable bowel syndrome, poor sleep, chronic pain. These are the findings that we see. We have oxygen deficiencies. Neuromisfiring. The brain is not in sync. It's not communicating with the rest of the body like it's supposed to. Metabolic imbalances, blood sugar problems, anemias, cortisol, inflammation problems, sensitivities to food, diet, environmental things, hormonal imbalances, autoimmune attack, brain imbalances. Okay, these are components that are all core to these chronic issues that we're dealing with. When we're talking about brain here, just briefly, we've got the right side of the brain and the left side of the brain. And so proper evaluation can help us begin to narrow down where in the brain are we dealing with issues. It's not enough just to say, well, it's my brain, it needs to be worked on. It's not enough just to be picking up crossword puzzles and doing crossword puzzles. It's not enough just to be picking up Sudoku and working on Sudokus. You've got to understand what area of the brain is not working right and what can be done specifically to deal with that. So in my office, we have what we call an outside-the-box approach. Inside the box, that's what your insurance companies determine which is adequate and acceptable. That's what your medical doctor may say. But for many, many people out there, this inside-the-box approach is not giving them the results they want. What good is it to be forking out premiums to your insurance company if they can't provide you with the services that are actually going to help you get well? Okay, what good is it to be limiting yourself in the type of care that you're receiving simply because insurance may or may not cover it? They have got us in a stranglehold. We need an outside-of-the-box approach to help us get past these problems that we're dealing with and onto better health and wellness. What makes my office different from every other office or every other doctor you've seen is that we look at you from a metabolic and a neurological standpoint, even more than that, because we look at diet, we look at energetically, we look at things in a much more comprehensive fashion because that's what you need in order to lick these problems. So we like to say we don't leave any stone unturned in our efforts to find the exact cause of what's going on with you. Now, a couple of ground rules I want you to get, and for some of you may have a hard time swallowing this, and all I can do is tell you this is the way it is, okay? This says you cannot be a smoker. You can be a smoker, but I'm going to tell you that if you're a smoker, it's going to severely hold back your efforts in other areas to get well. So I have had patients we have worked with as smokers. Usually their progress is going to be slower. It's going to take more time, but they do still get some results. You have got to be prepared to make some lifestyle changes. Okay, I can show you how to do that. That's what I'm here for. But you have to be the one who's willing to make those changes. And you have got to take personal responsibility of your life and of your health. Okay, it's not the government's job to get you well. It is not your insurance company's job to get you well. It's not your employer's job to get you well. It is your job. You take responsibility. I am here to help you. I'm here to guide you. I'm here to take you in the direction you need to go, to give you the encouragement and the coaching that you need, but you have to take responsibility. The buck has to stop with you. And the last one says insurance is not going to cover this type of care. This usually is the case. Not always, usually is the case. So what I tell people is be prepared to pay for this out of pocket, be prepared to pony up for this on your own, and if you can get the insurance to cover, it's icing on the cake. But if they don't, hey, at least you're working at getting your health put back in line. And really, the important thing here is getting you results. Okay? The important thing is helping you to stave off future metabolic and neurological problems, getting your health and vitality back, helping you functioning again, getting your life back. That's really what this is about. We've got to get off this medical merry-go-round that's not taking us to any destination. We just seem to be going around in circles. So some of the unique things that we do in our office is we do quite a bit of testing, very comprehensive blood profiles. Again, these are not your typical things that your medical doctor is going to order. Immune panels. We look at adrenal gland health. We look at food sensitivities. And if necessary, we even look for bacteria and viruses and stuff like that. Once I've gotten those results back, along with our neurological evaluations, now we begin to look at how can we help to support these different pathways through what we call functional medicine, eating better, changing lifestyle, taking appropriate herbs and nutraceuticals to help support gut function, the thyroid, the liver, adrenal glands, anemias, blood sugar, autoimmune, all of that fun stuff. Okay, so brain-based therapy is one of the therapies that we actually utilize here. It was developed by Dr. Michael Johnson, and the brain-based therapy is actually utilizing a form of evaluation to find out where there are deficiencies in the brain and then targeting those through specific therapies. The end result is that we can get those areas to function better. So this is kind of normal brain function. We see the information comes up in the lower brainstem and into the midbrain, gets passed into the cerebellums, and then from the cerebellums into the right and the left brain, and then that feeds back into the lower brainstem. So as long as we have this loop that's taking place, we actually have proper brain function. But what will happen over time is that we get kind of a breakdown, and so we can't get that feedback, and so we have one area of the brain that may be functioning in a more dominant pattern than the other, and that imbalance is actually what begins to lead to neurological manifestations. Whether it's balance, whether it's awareness or tendencies more towards right brain or left brain functioning, and that's where we have to put that balance and that regulation back in. So these things can happen from a chemical standpoint, such as a poor thyroid function, from physical, trauma, emotional, stress. I've already talked about some of that. But what the end result is that it causes what's called a decreased frequency of firing, meaning that the brain is not firing back through those loops like it's supposed to, and so we have one side firing at a higher frequency than others. And when we disrupt brain function, there's some symptoms that we can get: high blood pressure, chronic pain, chronic fatigue, blurred vision, migraine headaches, swelling, heart palpitations, irritable bowel syndrome, urinary tract infections. And again, we think of these in our traditional healthcare model as, well, these are the problem. Oh, you have an infection. Here, let's give you a drug for that. Well, no, you have poor regulation of the brain on the digestive system to be able to fight off, and the immune system to be able to fight off infection and evacuate and avoid the bladder like it's supposed to, and as a result, we're getting stasis and things staying in there and infection. We're looking at things from the wrong end of the problem. That's what's happening. So some things that can happen from interrupting with the brain, again, function of the brain. So we can have episodes of depression, difficulty scanning pages, so we have a hard time reading. This happens a lot with kids who don't like to read. It's not that they don't like to read, it's that they have trouble reading and it becomes frustrating, and so their excuse is, I don't like to read. Difficulty adding or subtracting. Okay, that's a brain function. Difficulty expressing what you want to say. It's like, I got it on the tip of my tongue, but I can't get the words out. Difficulty understanding what other people say. Sometimes people will say things and all we hear is just noise, and it's like, come again? Could you say that again? Loss of short-term or long-term memory. Loss of sensation, numbness, changes in handwriting, big time. If you've noticed that you've had a change in handwriting, that is a pretty much kind of an all-over brain degeneration symptom. You may become more irritable or angry. Problems with balance, tripping, dropping things, learning disabilities. These all fall into some neurological concerns. Now, your brain needs two things in order to function appropriately. It needs fuel and it needs activation. So let's talk about activation here briefly. There are there's activities that the brain needs to stimulate it. It's kind of like a muscle. If you work a muscle, it gets stronger. If you work that specific area of the brain, it functions better. So if we don't get proper stimulation, if we don't get proper activation of the brain, then we follow that premise of you use it or you lose it. You begin to lose functionality in that area. The other one is fuel. There's two types of fuel, and only two types of fuel that the brain can't use, and that is glucose, which is your sugar in the body, and oxygen. So if you have blood sugar imbalances, if you're not getting enough oxygen, you're going to affect the brain's ability to function. So there are things that we can do to help stimulate brain function. They can deal with balance and postural exercises, auditory or sound stimulation, visual tracking, light stimulation, olfactory, proprioceptive exercises, balance, vestibular exercises, adjustments, rhythm and timing exercises. Nutrition is also going to be influential. And so basically we've got this breakdown, and we've got these little pieces of the puzzle that are all over the place. Okay, things aren't working in concert like they're supposed to. This is both metabolic and neurological here. And what we do is we begin to organize these pieces, correcting the misfiring of the brain, correcting the blood sugar imbalances, getting the oxygen better. We can start putting these things into their proper reference so that things begin to work right. And the end result is now all of the pieces together, we've worked on treating the whole person, and you're going to feel better. So regardless of whether it's a thyroid problem, whether it's a digestive problem, irritable bowel, migraine headache, fibromyalgia, chronic fatigue, neuropathies, by addressing all of these component pieces and putting them together, the end result is you're going to improve. You're going to feel better. You're going to make headway. Okay? And this is our approach. You have to work on the whole body. You have to work on identifying and looking under every stone and identifying as many components are here and working on those in order to get the best results that you possibly can.